Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Today we'd like to discuss a very important subject only because seemingly it's been brought up in newspapers so much about the athletes and what they're doing to their wives and girlfriends and what other people are doing to their female friends and things like this. And it seems so out of order to think that we should only have a talk like this once in a while when it's happening every day, every night when you're sleeping. And she puts the baby to bed. She does all the household duties. She does all the things that make the home comfortable and so forth. And yet a husband can come home, whether he's drinking or not drinking, would give her a negative relationship in a sense. And this goes on every day behind the doors and so forth. I've seen so many come into my office, and every time they came into my office, they were wearing sunglasses when it wasn't sunny outside. I knew something was going on behind those glasses, you know, and she'd take off her glasses and she'd have a black eye, you know, and things like this. So I've been in homes where I had seen these mothers hurt or women hurt and so forth, and had to actually put them in the hospital myself just to get them out of a home. That's why I made house calls. You can't tell anything about anybody. You're sitting behind a desk and they're sitting in front of you and getting a medical history. You got to go to the home. And doctors don't go to home. Social workers go to home if they're called, you know. And some of the visiting nurses go to home. Many times I have hospitalized a patient from a home when she, with her eyes, told me she was being mistreated. She was laying in the bed. She had a condition, medical condition, but she would look at her husband and look at me and with her eyes say, "I'm dying." And I used to say to her husband, "Well, I think she really needs to be hospitalized." Just to get her out the home, could not call up, get her a bed, just to get out of that home so she could speak to a social worker and things like this. So what are doctors for? I mean, is it just to do a lot of preaching and writing, and but not ever go into the home with a patient or know anything? In fact, this, before we get into the talk, I did my residency at Kings County Hospital. And when women would come in with lower pelvic pain, even the doctors would say sometime, why did she have to wait till midnight? Not realizing that she had to get the children to bed and leave them at home so she could get to some medical care at night, coming in there. And they used to say derogatory things. And so I wrote an article at that time called Souls Up, Souls Down. And so, you know, when a woman's put into stirrups, her soles of her feet are up, but the soul laying on that bed, they don't know nothing about. They don't know the history, they don't know the culture, but they'll make jokes about it and so forth. And I got a lot of arguments with other doctors who treated patients or women patients like that. So today we're going to talk about things women go through. And right as we're sitting and talking right now, how they're being abused by boyfriends. High school girls now are coming out saying how they've been raped on rape dates and all this kind of thing. How about letting your daughter go to school or go out to a party and think that she could be raped in a nice dress and she feels good about herself and somebody rape her at a party? So these are things that we have to take up in our hospitals and our social workers and our doctors. How about the doctors? How about teaching them a course in this kind of stuff? They don't know anything about this kind of thing. And so therefore, we're going to talk about that this morning. So I want to welcome, say your name.
Lorraine Brooks, how are you, Dr. Deas?
Yes. Lorraine, I know you've been working in this thing so long.
Yes.
With the walls covered with women who've been abused. And magnificent. I've never seen such a gathering of pictures and things that you all have done just to bring it up to the hospitals, how these women should be looked at and what's going on with women. But I'll let you explain how you got into that, and we'll go on with the discussion.
Well, you know, Dr. Deas, thank you for mentioning that photo exhibit, because we have a committee here at Downstate, the Domestic Violence Awareness Committee.
Right.
And we do a lot of work about just exactly what you're saying, talking about it, having people break the silence, as we say.
Oh, yes.
And we thought it was important to put faces behind what we were saying.
So important.
So as you know, we did a series of, we had almost 400 pictures on that wall.
I saw that.
Of people who worked here, some staff people, students,
Yeah.
visitors, even
Right.
some patients from the hospital who were walking through the lobby and they wanted to stop
Sure.
and have their pictures taken. And what we did was we asked everyone to wear something purple.
Purple,
Because
yeah.
purple is the color
That's right.
of domestic violence prevention. And it was so moving and so powerful.
Right.
Every time we do something like that, I tell you, in my job as, I'm the director of the Employee Assistance Program.
Right.
So I hear a lot of people's stories, as you do. And people are not, they don't want to talk about it to just anybody.
Right.
They have to find a person that they trust. They have to find somebody that they know will understand what they're saying
Sure.
and give them good advice. And
Right.
not everybody can do that.
No.
Even people who mean well and want to help, they don't always know exactly
They're not
how
trained.
to, and they're not trained. Exactly.
And this is like anything else. How can you go off the top of your head and start talking about
No.
something as serious as this?
You cannot.
No.
You cannot. So that's one of the reasons why we're doing this show and why we do this outreach every October, is to start a dialogue. And now there's a lot of, I don't want to even use the word information, but there were a lot of things happening
Yes.
with these NFL athletes, a couple of
yes,
them a couple
sure.
of weeks ago. Ray Rice, who hit his then girlfriend, now wife,
In that elevator.
in an elevator and knocked her unconscious.
Yeah,
And then
drag
her
her.
body out of the elevator.
I mean,
How do things like that happen in 2014? But they do.
because we have cameras.
Well, thank God.
Thank God for
We
cameras.
wouldn't, you know what? We wouldn't be talking about this if there wasn't a camera there.
The silent camera.
We wouldn't even be mentioning
right.
this.
But-
And you're right, it
But
happens
eyes tell
every
everything.
single day.
Eyes cannot tell lies.
Amen.
Right?
Amen.
Yeah.
But it happens more than we know.
Oh,
It's not
yes.
just women. It's not just men hitting women
No.
or abusing women. It's sometimes women abusing men.
Oh, I've
It's
seen
sometimes
those.
same-sex relationships, two
Right.
men, two women. And when things like that happen, we usually think of it as a woman's problem.
Yeah,
Know
sure.
that it's a woman who's getting abused or it's a woman who's getting hit, but it's not necessarily true. In fact, Ray Rice's wife, the woman who was his girlfriend then, but is now his wife, I noticed a couple of weeks ago that she had a press conference and she said that she was taking some of the responsibility. She said, part of this is my own fault because I hit him first or I hit him
Right.
in the past, and so she was taking a lot of the responsibility for it, and I just feel bad for her. I think that she is very misguided. I want one of the messages that we want to send to
Right.
people is, it doesn't matter what you did. It's not your fault.
That's right. That's right. Well,
You
we
know,
were just like I mentioned, girls going out to a party to have a nice time with a nice dress on and makeup and things like this. Just recently, it happened where somebody took advantage of somebody. It was all in the newspapers after dinner type of thing, and raped a person.
Yeah.
I mean, where's
does
this
that?
going? That's
Right.
right.
Well, and then what we do as a society is we blame the girl.
Oh yeah.
Because what was she wearing,
That's
or what
right.
what kind of shoes did she have on? Or
Sure.
she had too much cleavage showing,
That's
or
right,
whatever
sure,
it is.
yeah.
And we as women, we take that on.
Oh sure.
We take, and that was exactly what Ray Rice's wife was doing.
Right.
She was taking it on. She was saying, you know what, I had a part to play in this. And I don't know. I don't know the circumstances, and I obviously don't know what goes on in their relationship.
Right. Sure.
But even if she was the abuser, even if she was the primary abuser, I would be saying the same thing to him. I would be saying, she shouldn't be hitting you.
That's right.
Right?
Of course.
It doesn't matter who
it
hits
does
who.
happen. It does happen.
So,
really.
but the other thing I want to say, if you don't mind, is it isn't only about getting hit.
Right.
That's only one small piece, and not
Sure.
everybody gets hit.
That's right.
It's about bullying.
Oh yeah.
It's about stalking.
Oh yeah. Sure.
It's about keeping tabs on the person and not letting them go freely in the world. Always have to know where somebody is. It's about controlling the finances.
Sure.
It's about putting fear in the person. It's a whole constellation of things.
Mirage of things.
Yeah,
Sure.
and we don't. Sometimes we think, well, he's not hitting me, and whenever he's not hitting me, everything is okay. You know, he only
Yeah.
hits me sometimes.
Yeah, right.
But what else is going on? Is he keeping you from your friends and your family? Is
That's
he
right.
not letting you have access to money?
Sure.
Is he got a cell phone on you that you have to call him every hour and tell him where you are and where you're going and how long it took you to get from point A to point B? And
Sure.
all of those things are controlling.
It is.
And
You know, I was just looking at Proverbs, and they'll talk about a virtuous woman, what a jewel she is and gem she is, you know, and how we could treat a gem like this after we marry her and take vows and all this kind of thing. But everybody has these points of anger. They coming home from work, something might have happened just terribly at work with somebody, and they'll come home and take it off on their wife. You know, or alcohol comes into the picture.
Sometimes it does.
Alcohol
Sure.
comes into the picture, even drugs, because the woman, she's turned into something that will calm her down as such, and there's another problem there.
That's right.
You know, being a drug taker,
Absolutely.
just to take care of the pain of emotions. You know,
And that's the thing. We have to learn how to deal with our emotions better,
surely.
rather than hitting people and trying to control them.
Oh,
Because
yeah.
really, what are you trying to do when you try to control somebody?
Surely.
It's about fear, isn't it?
That's right.
I don't want you to go out there and meet somebody else, or I don't want you to go out there and John down the street is going to find you too attractive, so
That's right.
you can't wear that skirt because
That's
John is going to look at you if you wear that skirt.
That's
well,
right.
you know, I mean, I think sometimes the way we think about things
Surely.
needs to change.
Well, you know, I just
know?
look at a man, if he doesn't wear a certain kind of suit and things like that, they certainly sell enough shave lotions to attract somebody.
Right. Right.
You know, so she should say, well, just wash your face with some Lifebuoy soap, but don't put no shaving lotion on, because we don't want you
Same
to
thing,
smell
exactly.
good at the water fountain at work.
Exactly.
You know what I'm saying?
Exactly.
Surely.
But what really is that?
Yeah.
You know, that's somebody, and that's what domestic violence really is this pattern of trying to control somebody, trying to coerce them, trying to get them to behave in a particular way that makes you feel comfortable.
Yes,
right?
right.
So if you're my boyfriend and I think you're handsome and I like the way you look and I like the way you're dressed,
Right, sure.
but I only want that to be something that I see.
I do. I see.
And I do.
That
right?
I do, sure.
So you can't wear that suit out, because
That's
if you
right.
wear that suit out, you look too good.
In
So
fact,
I'm trying to control you. I'm trying to control what you do and how you do it.
In fact, sometimes my wife says to me, "You look too shabby."
You look too shabby.
That's the twist. That's the twist.
That's what you're supposed to do, right? You don't want anybody else looking at you. That's the whole idea.
Right. But getting back to your what you have done at the school here for many years, and bringing this to the force of people going to lunch or walking down the halls to be acknowledge what's going on.
Absolutely.
You know.
And it's really important, especially now with Ray Rice in the news, and a lot of other domestic violence situations are coming to the forefront. And now there's a big initiative in S.U.N.Y. And you know, of course, we're a part of S.U.N.Y.
Sure.
About sexual violence,
Okay.
rape
Oh,
on
yeah.
campuses, on
Sure.
college campuses.
Oh, boy.
And so you're exactly right. You
Sure.
know, how do you teach people though how to respect one another? You know, and how do you teach women how to protect themselves? And even taking a step back from that, why do we have to teach people how to protect themselves? Why do why do we even have to address that? But we do.
Right.
Obviously, we do.
A lot of folks have mothers, and they have respect for their mothers. Mm-hmm. That should go right to respect to the young lady
Your
or
sister,
a girl,
your wife,
sister,
sure, of
and so
course,
forth.
of course.
You know.
You know, and on college campuses especially, there's a lot of alcohol
Oh, yeah.
being used. There's a lot of nowadays texting and, you know, all the social media where people put their whole lives
On screen.
for
Oh,
everyone to
yes.
see
That's
where
right.
they're going, who they're with,
Yeah.
pictures of themselves. I was watching a television show not too long ago where there were some girls, college-age girls, actually they were high school-age girls, very proud of themselves because they had set up a website where they were posting pictures of themselves
Right.
being drunk
Right, yeah.
and having sexual activity with other boys
Yeah.
at parties.
Yeah.
And they were very proud of that, Dr. Deas.
Yeah. You know, when you think about the Roman, how great the Roman Empire was, when I went to Greece or these different places and saw all these masterful halls, and man, the stuff that was going on in Greece in those days was something else. I mean, you know, it was nothing that the Bible was
This is
right
nothing
about.
new, no.
It's nothing
Yeah, no,
new,
it's nothing
you know.
new.
Men have always been that person that can challenge that woman constantly. And that's a hard life to live, because you're always looking at yourself in the mirror. You're looking at yourself whether you should take a drink or not, and so forth. And I don't know the answer to it all. All I can say is that I think doctors and social workers should have good courses in this kind of thing, rather than wait for it to come into an emergency room, just like abusing children. Doctors should be aware when a child didn't fall out of a crib, or a child didn't trip by themselves on the floor and get a black eye. You know what I mean? Right away, you should be aware of that and be able to call in a social worker immediately, part of the treatment while they're there.
Absolutely. And we've been trying to do that here at Downstate for years. We have a team of people
Yes.
that includes social workers and people from emergency medicine,
Right.
and people from public safety, and various staff people who have been trained
Right.
in how to recognize the signs of domestic abuse,
Right.
and also what to do, where to
Okay.
refer them. We have a relationship with a couple of shelters in the area where we can refer people if they need to get away.
Well, that's good.
We have a lot of resources here on campus that are available, not just to staff, but also to patients and people coming in from the outside. Because you're right, you have to know, and you have to not just know, but you have to trust your instincts, and you have to listen to people. You talked about that woman's eyes.
Yes, right, sure.
And all she could,
That's
she
it.
could just do, right? And you
That's all
picked up
happened.
on it right
Picked up,
away.
and I had to hospitalize her. But that's not only just the first case. I had to go in many places that were just horrible, that you could just give somebody an antibiotic. I went places where it was so cold, or you could feel the ice crack beneath your feet as you walk on the carpet and things like this, or just look in the bathroom and see what's going on, see what's on the stove, or see whether they have heat or anything. But all these things, a woman has to take care of that home, and just a little thing, a man coming home from work and he sees things that he hasn't even provided for and he dislikes, he'll take it out on her, and that she is
But you're right, you don't know that unless you wouldn't know that unless you went to the person's home.
That's right.
Right?
That's
because
right.
when we come to work, we're all dressed and we're all nice,
There
and
you go.
you would never know
No.
what was going on in your life or my life unless I tell you.
I tell you, that's right. Yes.
Or unless something really, really bad happens.
Right.
We've had people here who both parties worked here at Downstate, both the victim and the perpetrator, both were employees here.
Right.
And we've had instances where people have had things happen to them right here in the workplace. People have been hit, people have been injured by their spouses, by their significant others right here in the workplace.
Workplace,
But if
yes.
it doesn't happen here, or we don't see it, we have no way of knowing. That's why we want people to talk about it. That's why we have to break the silence.
Well, and another thing I haven't seen so much, unless it's Mother's Day, is that churches participate in this. Because you have everything from a storefront church to cathedrals, where women are abused, by not only by ministers, by choirs, directors, and all these kind of things and so forth, and they're afraid to say anything and so forth, because she wants to be active on the choir, for example, and things like that.
Well, sometimes we put a lot of emphasis on the way things look, on doing the appropriate thing for people to see. And then when we go and we live our regular lives, our normal lives, the way we really live, it's very, very, very different. And sometimes, I don't know how often, but sometimes the people who are the most vocal, or the people that you would least think are sometimes the people who are the most likely to be in that position.
Right, sure.
Sometimes people use their position, or they use their affiliations to cover up for things.
Right, sure,
That happens too. But I think the basic message, Dr. Deas, is we're trying to get people to not be ashamed. And we're also trying to get people to understand that whatever happens to you isn't your fault. If someone hits you, that's their responsibility, not your responsibility.
Right.
And it works both ways. This, again, I hate to keep talking about Ray Rice's wife, but she said that. She said, I hit him first. And I'm going to say the same thing I said before. Then he should have left her, or he should have done something to get her, you know, to stop abusing him, if that's in fact how it started.
Right.
Because she shouldn't have been hitting him either.
Of course not.
Right? So I think the important thing is to know that, A, there are places you can go and talk about these things where you will not be judged and you will not be seen as anything less than. The other thing is, no matter what happens, everybody's responsible for their own behavior, and behavior is a choice.
Right, sure.
I don't have to hit you. And the other thing is, when, you know, if I'm the kind of person that I'm going around punching everybody, then I have a problem. You could see that clearly. I'm punching out the checkout person in the supermarket. I'm punching the guy pumping the gas. I'm just punching everybody. Okay, but if I'm only punching my wife,
Yes.
but that's the only person I'm punching, then that tells me that you know how to control that behavior when you have to. Because you're not going to work punching out your boss.
That's right. And
But you're coming home and punching out your wife. So
you're
that
behind
tells
closed
me
doors.
exactly.
You know.
You're picking your victim carefully.
Yeah.
And you're choosing this person as a victim. It's not just random. So that's how we work with perpetrators. We try to get them to understand that their behavior is a choice.
And you know something else,
coincidence.
Also, ethnicity. You know, sometimes different ethnic people have different ideas about things and don't understand what that culture of that person is going through and so forth. And so we're so lacking sometimes in the African American community to have trained people to take care of these kind of things. And a lot of people out there wanted to become social workers but got distracted and didn't do it. But we don't have a dearth of African American social workers and psychologists and things that our people can go to so readily. So they have to choose a family member or a friend to talk about it and things like this and so forth. So that's the other thing I think that we have to do is try to encourage in our colleges and things that more of these youngsters start taking up these kind of fields where not only just for that
Helping
purpose,
profession,
but
sure.
just for the whole socialization.
You even said it in medical school. You don't learn about this kind of thing.
Nothing at all. And yet you can go and take a history, the social history. Where do you work? You know,
Right, exactly.
or what have you,
Right,
and things
right.
like for trying to find out what disease they have, but not what kind of dis-ease they have. There's a difference between disease and dis-ease. You know, you got to
That's
get
right.
into the person and say, what kind of dis-ease do you
Yes.
have, and what does it do to?
Yes.
That's giving you.
And a lot of times the diseases are a result of the dis-ease,
That's
right?
right. Oh, yeah, sure.
High blood pressure and heart problems, correct? And
yeah.
addiction, certainly.
Surely,
you know, I mean,
surely.
if you're not uncomfortable or you're happy and satisfied in your life, you're less likely to develop some of these diseases, you know.
Surely.
So you're absolutely right.
Yeah.
But we have to train people. We have to train physicians. We have to train
Right.
people of the cloth, pastors, people in,
There you go.
you know.
Anybody that has contact with women in
Absolutely.
general, you know.
Yeah.
But this time runs out on us. Time is our enemy. In closing, what would you like to leave?
Well, I would like to tell people that Downstate is a safe place.
Right.
And we have people here who are trained
Right.
and who know what to do if you have experiencing the problem. But the real message I want to send is not to be silent about it. Find someone that you trust,
Right.
that you can talk to, and who has some information. And don't be afraid to admit what's happening.
Yes. Well, Lorraine, certainly time has gone by so fast.
Dr. Deas,
but-
my pleasure as always.
But to you folks out there, don't take it lying down. Don't take anything lying down. You're a human being. Your need to be treated wonderfully by husbands, by boyfriends, by children, children can be abusive as well and things like this. And so I hope that this little time we have spent with you right now will just alert you to be kind and show kindness to everything. I mean, life is so short a period of time, and why waste it on abuse and hurting somebody? Take care, and we'll see you the next time.
And these are two of our students who came out to pose for us as well. We like the students to get involved. We're trying to increase their awareness while they're in medical school, because we know that when they go into practice, they're going to see a lot of people as patients and in their practices who have been victims, and we're trying to get them to understand the issues that are involved. So we like students to be involved. This is Miriam Vincent. She's the chair of our family medicine department. And I felt that it was important to have her as part of this display as well, because family medicine is a specialty that sees a lot of people in a family unit. And for us to be aware that domestic violence not only affects the individual, but also affects the family. So it was very important to us to have Miriam Vincent on board, and we're very proud that she participated.